All right, everybody, Dr. Rafich from Vet Triage. We're continuing through this issue of JAVMA, July 1st, 2015, Pathology in Practice. This is a pony case today. Let's see, these are images at necropsy, so the horse was euthanized. And what we're looking at here in picture A is the T18 vertebral body. In picture B is a zoom-in shot of the same vertebral body. And then in C is a section of the left forelimb. It is a 12-year-old pony of the America's mare, 2-week history of weight loss, 1-week history of inappetence, lethargy, fever, grunting, pain, inability to rise. In panel A, and right here, there is a mottled red, tan, brown discoloration of the vertebral body. That's the arrowhead, that's right here. Hypaxial muscle, red, tan discoloration of extradural adipose tissue, right, the arrow right there. The spinal canal is labeled with an asterisk, right there. Then in B, the bony tissue, which is the arrowhead here, is visible radiating from the cortex of the vertebral body, which is the arrow. And panel C, abundant red-tan friable material within the tendon sheath in the radiocarpal and intercarpal joint spaces of the left forelimb. So, other findings on physical exam before necropsy: tachycardia, pleural roughening on ultrasound of the thorax, total white blood cell count with a toxic left shift, leukocytosis, neutrophilia, anemia, monocytosis, hyperfibrinogenemia. Cytological examination of abdominal fluid was normal. Necropsy found a soft 10 by 8 by 25 centimeter red-brown mass that expanded the retropleural and retroperitoneal space ventral to T13 to T18 vertebrae with necrosis of the psoas major muscles. The dura of the spinal cord in the T5 to S2 region was covered by red-tan material that expanded the extradural fat and was most abundant in the caudal thoracic region. Friable red-tan material expanded the sheaths of the superficial and deep digital flexor tendons of the left forelimb to the level of the carpus, extending 10 centimeters proximally and distally. The synovium of the left carpal joint was thickened, and red and joint spaces contained the same red-tan friable material. So then we have here some histology right there as well. And in that histology, we've got in the top view proliferation of new bone in the periosteum and abundant suppurative inflammation. And then in the bottom view, extradural tissues, including epidural adipose tissue of the vertebral canal, expanded by hemorrhage, fibrin, and inflammatory infiltrate, epidural steatitis, and spinal cord is included. They found fibroplasia, degenerating neutrophils, colonies of gram-negative rod-shaped bacteria, remodeling by osteoclast, vertebral myeloid hyperplasia, the dura of the spinal cord covered by a dense plaque of fibrin with a myriad of degenerating neutrophils and mild multifocal hemorrhage. Spinal cord was affected by myelin degeneration and phagocytosis, known as digestion chambers. Swollen axons, known as spheroids. Spinal nerves had inflammation and fibroplasia and digestion chambers. Lots of fibrin hemorrhage. Viable and degenerating leukocytes, mostly neutrophils and macrophages, were present in the carpal joint space. The synovial membranes were hypertrophied and hyperplastic, forming papillary projections into the joint space. Lymphocytes, plasma cells, macrophages, neovascularization, immature fibroplasia. The horse also had interstitial pneumonia, splenic and lymphoid depletion, and systemic congestion. Bacteria culture found Klebsiella pneumoniae. The morphologic diagnosis and case summary: chronic suppurative thoracic vertebral osteomyelitis and periosteoitis, suppurative spinal pachymeningitis and epidural steatitis, axonal degeneration, chronic carpal tenosynovitis, and arthritis left forelimb. Summary: vertebral osteomyelitis and paravertebral abscess due to Klebsiella pneumoniae infection, carpal tenosynovitis, and arthritis in a pony. Comments: osteomyelitis is defined as inflammation of the bone and bone marrow, resulting in bone destruction and caused by infectious microorganisms. Vertebral osteomyelitis have been reported in dogs, cats, calves, lambs, foals, and infrequently in adult horses. Hematogenous spread from a primary site of infection, traumatic injury, or contiguous spread from an infection of an adjacent soft tissue are all possible causes, but also iatrogenic inoculation from spinal surgery can serve as a source of infection in applicable species. Moderate to severe elevations in serum fibrinogen concentration, so 900 mg per dl or greater, are a diagnostic indicator of physeal or epiphyseal osteomyelitis in foals. Evaluation of cerebrospinal fluid samples from horses with vertebral osteomyelitis may reveal no abnormal characteristics. However, a small number of affected horses have had high total protein concentration and white blood cell counts in the spinal fluid. Bacteria culture of the blood usually yields no growth. You can start with plain radiographs. If you have the opportunity for MRI or CT, those are even better. Ultrasound can also serve as imaging for horses with vertebral osteomyelitis. Treatment is long-term, broad-spectrum antimicrobial and anti-inflammatory, surgical exploration, debridement, drainage. Penicillin and trimethoprim sulfamethoxazole has been used in horses with vertebral osteomyelitis. Interestingly, the median time between onset of symptoms to diagnosis was 1.8 months in a retrospective study of vertebral osteomyelitis in 250 humans. That interval can range from 6 weeks to 7 months, exemplifying the subacute nature of the illness, the insidious progression, and the fact that clinicians are unaccustomed to consider vertebral osteomyelitis as a differential because of the rarity. The presence of bacteremia in the pony in this report was supported by the suppurative interstitial pneumonia, lymphoid depletion, and systemic congestion. In horses, hematogenous spread of bacteria is typically limited to foals with septicemia. And then in a previously reported equine series, the suspected nidus of infection included infection and abscesses in the paravertebral area, lungs, or mediastinum. So a pretty wild case report. It's obviously it's a rare situation, so this one's worthy of a case report. And a lot of it mirrors the small animal side anyway. None of this is really that unique to horses per se. So cool case. So for veterinarians, just a reminder to keep this on your differential list. And then for pet owners, horse owners who get frustrated with kind of a chronic, insidious progression of a disease that nobody can figure out, there's something to keep in mind as well. All right, we'll see you guys next video. Thanks so much.